Delegates, we will now move to item 10 of the agenda, that is the European Action Plan on alcohol 2022-2025. We have various documents on this. You can see their reference numbers on the screen. As an introduction, I would like to remind you that the 75th World Health Assembly in May adopted a new action plan for 2022-2030 in order to commit to the implementation of the global strategy for reducing the abusive consumption of alcohol as a public health priority. The RC72 is now invited to look at a new framework for action, new European framework for action, to define directions of work on this topic. And I would turn immediately to the Secretariat and to the various guests who will tell us their thoughts on the topic, and I have the pleasure of giving the floor to Dr. Nino Berzui, who is Director of Communicable Diseases in Europe. Nino, you have the floor, and I'm looking forward to your presentation also of the panel that will share with us their thoughts on the topic. Thank you.
Thank you so much, Chair. Honorable Ministers, distinguished delegates, thank you again for joining us for this session. I will be very brief introducing this topic, the regional framework on alcohol, for the sake of time, giving more time to our panelists, distinguished panelists, who are representative of the member states and the civil society organizations, as well as to you, dear member states representatives, because we're going to see the short video presenting the regional framework. I will focus on a few points. Since 2019, the WHO Europe has been working with the member states, listening to your voices and the suggestions on the regional framework, as well as the civil society organizations, drawing also on the best available scientific evidence on reducing the harms due to alcohol. After intensive consultations, the European framework for alcohol was developed, which is based and provides the evidence-based guidance based on the principles, clear public health benefits and the goals on how to accomplish a safer WHO European region free from harm due to alcohol. And we can achieve this vision and the goals with your strong political commitment and the bold actions. The three WHO best buys, increasing taxation, reducing availability of the alcohol, and restricting marketing are three core principles that lie at the heart of the framework, along with the three other key areas that will be presented in a few seconds in the short film. WHO will support member states implementing the regional framework for alcohol by providing the policy options, providing guidance and tools, and facilitating transnational and intersectoral collaboration. A fast-track mechanism for monitoring and surveillance will be established, which will enable the member states to assess the impacts of the policies, as well as identifying where more actions will be needed. Let us now watch the brief video which outlines the core principles of the regional framework for alcohol for the WHO European region. Thank you.
During this film, at least 2 people in the WHO European region will die as a result of alcohol consumption. Alcohol is responsible for almost 1 million deaths a year in our region and is a causal factor for more than 200 diseases, health conditions and injuries, including at least 7 types of cancer. These deaths and harms are all preventable. We need to stop mopping the floor from the overflowing sink and turn down the flow from the alcohol tap. Since 2019, WHO Europe has been accumulating the best available evidence to produce the European Framework for Action on Alcohol 2022 to 2025. Priority areas include actions to reduce alcohol affordability through higher taxation and pricing policies, to reduce alcohol availability, and to restrict or ban marketing, to improve health information and labelling practices, as well as responses of health services, and to support community action. This is a framework for action to turn down the flow from the alcohol tap, action to protect young people and improve our communities, action to save lives.
Thank you. I'm delighted now to invite Catherine Mary Loftus, Secretary General, Ministry of Health and Care Services, Government of Norway, and Vesna Petric, Director General of the Ministry of Health of Slovenia, to reflect on the regional framework for action, and as well as their thoughts about call to action. Thank you.
Thank you, Chair, Regional Director, colleagues. The European Framework for Action on Alcohol is very much welcome, as the backdrop for the framework is quite worrying. We know that the disease burden attributable to alcohol consumption is unacceptably high, being the cause of almost 1 million deaths each year in our region, as stated in the video. And alcohol is a contributing factor to a number of widespread and serious diseases. It is also well documented that there is no safe level of use of alcohol, especially regarding the risk of cancer. The use of alcohol also causes a broad range of harm to others and leads to significant social and economic costs in the justice sector, costs from lost productivity, unemployment, poverty, and violence. It is also a fact that the European region has the highest level of alcohol per capita consumption. Norway therefore welcomes the framework that is progressive and so explicitly provides evidence-based policy guidance for member states to reduce alcohol consumption and the harm it causes in our societies. We also want to point out that it is well documented that there are a close association between alcohol per capita consumption and population harm levels for various types of health and social harms. The mean consumption in a population is closely associated with the prevalence of heavy and harmful drinking. The best strategy to reduce harmful use of alcohol is therefore to implement universal policies and measures targeting the total alcohol consumption in a population. This is also supported by the knowledge that there is no safe level of alcohol consumption free from potential harm and risk of developing diseases, for example, cancer. Norway has a comprehensive public health-oriented alcohol policy, with implementation of universal regulatory measures that are considered to be the most effective in limiting alcohol use. This is formulated in our national alcohol strategy and based in our Alcohol Act. The European framework is very much in line with our policy on alcohol, and for Norway, this comprehensive and evidence-based approach has resulted in one of the lowest levels of alcohol consumption in the European region. Thank you.
Thank you very much, and thanks for being the vocal supporter for the regional framework on alcohol. Over to you.
Thank you, Madam Chair. It is an honor for me to be invited to this panel, and I have to congratulate you. If we want to implement the framework, we are the right people here on the panel: academia, NGOs, and us, member states. Alcohol policy as a public health topic is a public health topic where, similar to tobacco control, we are confronted with competing health and business interests. We spent 40 years and more to deal with tobacco control based on science and evidence, and finally adopted a WHO legally binding document at the end. We are not yet there in alcohol policy, but we have agreed at the WHO on the strategy and an action plan, and here we are with a framework to implement. While understanding that our governments still struggle how to best balance health priorities with, for example, economic interests, this should not be the case here in our discussions at the WHO, where ministers of health discuss health priorities. From our regional office, we expect nothing less than respecting existing and new evidence when preparing reports, frameworks, tools, and guidance. This is the only way that when deciding to act, our decision makers will be able to adopt their decisions with all the responsibility. Now, let me look a little bit more to implementation. The framework should be seen as a clear signal to WHO Euro to prioritize this area and ensure support to us member states in implementing evidence-based actions. My country, and I believe many other countries, need technical support and opportunities to share good practice, work together in developing innovative solutions in this area. We, of course, have to also monitor or benchmark the progress in our region and empower our professionals, decision makers, and media by new evidence and also by proposals of action thereof. I was very pleased to see in the framework the commitment of regional office to assist us in networking and showing best practice and sharing best practice by re-establishing focal point network and planning for ministerial and conferences and other events. Slovenia, in desperation actually, stepped forward and together with you, WHO Euro, organized several side events at UN and elsewhere because we really needed such events, and here we are now, we have it in the framework, we appreciate it so much. We speak of equity and health a lot. It is very important to understand that in implementation, equity has to do with identifying the needs of those most vulnerable, developing tailored measures, and enable that those in need can access the services available to them. This cannot be done without intense cooperation of health sector with civil society. And I repeat, if we want to address appropriately young people, we should know they are very well organized and ready to work with us, as are other more alcohol-focused NGOs. I'm very happy to see them represented here, all of them. Thank you very much.
Thank you. Thank you so much for your intervention, and of course, thanks for emphasizing the importance of the science and the evidence being the basis of all decision-making and actually the regional framework document, as well as the background document that supports the regional framework for alcohol, for action on alcohol, is built on the strong science and the evidence. And of course, thanks so much to Slovenia for strong support in the process of development of this regional framework for action. And rightly said, the implementation of regional framework for action on alcohol will be only possible through the strong collaboration between the member states, the civil society organizations, and academia. And now I would like to pass the floor to our first representative from the civil society organization, youth representative, which are very important constituency in the vocal group in implementing the regional framework for action. On behalf of CASAS, I would like Montenegro, which is part of the Eurocare, European Alcohol Policy Alliance. I would like to pass the floor to Aida Stepsnik.
Dear all, I'm Aida from the International Youth Health Organization, and it's an honor to speak in front of you today. Youth are the fastest evolving demographic in the world and are vulnerable due to fast changes in their lives. As a society, we are responsible for providing a healthy, safe, and sustainable future and opportunities for all youth worldwide. Young people are often not included in policy development and decision-making processes, which is why their needs are, more often than not, neglected in many health initiatives, programs, and strategies. We want to complement the European framework for including youth in the consultation process, but also to outline that it will, if implemented correctly, fully, and with accountability of all the involved parties, improve health and well-being of all young people tremendously. Alcohol consumption causes death and disability very early in life, with approximately 13.5% of total deaths of 20 to 39-year-olds. Data warns us that young people are losing their lives to a completely preventable cause. Youth deserve a healthy and alcohol-free future, and we should be more proactive towards fighting the myth of wet culture by removing normalization and social acceptance of alcohol consumption. This is the biggest challenge in many countries in the region, and we should join forces to empower and protect youth, but also build capacities across sectors to implement a comprehensive response. We, youth, cannot do it alone, which is why we ask for your commitment to the framework and cross-generational dialogue to tackle these challenges. We need you to take concrete and effective steps to improve alcohol policy at all levels. I'm also inviting all of you to think about the legacy you want to leave for your children and youth, providing them with an effective systematic response toward alcohol harm and consumption is the best gift we can leave to new generations, because the right to health is a basic human right and we should never forget it. Champion the well-being of youth by investing in it today. Thank you.
Thank you very much for a strong call for action on behalf of the youth. And now I would like to invite the comment from Ms. Florence Bertelletti, Secretary General of Eurocare, the European Alcohol Policy Alliance.
Thank you so much, and good afternoon to all of you. I asked Mr. Kluger if I could call you brothers and sisters, so that's how I'm going to call you now. Before the end of my speech, 4 people will have died because of alcohol. And because of my past career, I am often told that alcohol is not as serious a problem as tobacco. And I'm pretty sure that perhaps you are asked this question within your own governments. Yet, the problem related to alcohol are just as alarming. Numbers don't lie. So, 2 people, including young people below the age of 20, die every minute because of alcohol in our region. So why are we still overlooking this grave issue? Perhaps the question is not why, but who should be responsible for dealing with this grave problem. Today, I would like to leave you with just 2 simple messages. Number 1, we know what to do, and we've known what to do for many years. You are responsible for dealing with it. The framework for action on alcohol is an innovative, useful, and, as it was said, evidence-based document. It should stay on your desk and should not be forgotten and put in a drawer when you go back home. Use it and implement it, please. And my second message is the alcohol industry, including the wine, the beer, and the spirit big corporation, are the biggest barrier to progress. This is the reason why no progress, or almost none, has happened in our region. So my message to you is actually don't work with them. They are not part of the solution, and they are, like the tobacco industry, part of the problem. So to conclude, we know what to do, you know what to do. Don't trust the industry, and civil society, all of us, we look forward to implement the alcohol action plan with you in the years to come. Thank you.
Thank you very much for your strong call for action. We have a very rich panel of civil society organizations that are championing the regional support for regional framework for alcohol. And now I would like to invite Laura Plessner, the International Federation of Medical Students Association, on behalf of Movendi International. Floor is yours.
Thank you for giving me the floor, and it's an incredible honor to speak on behalf of Movendi International. Movendi International members work in communities across the region to protect people from the harms caused by alcohol industry. We commend WHO Europe for the extensive consultation process where many of our members contributed since 2019. We endorse the framework for action on alcohol. This discussion marks a crossroads for the European response to alcohol harm. In the last decade, we saw alcohol taxation being the most ignored alcohol policy solution, even though it is the single most cost-effective one. While cheap alcohol is damaging our societies and draining our economies, alcohol becomes even more affordable. Alcohol causes massive social harm. When alcohol's second-hand effects are added to the direct harms to alcohol users, the total alcohol burden is double from that from tobacco. But the most vulnerable members of our communities are still left unprotected. Science knows since 1988 that alcohol causes cancer, but the public still doesn't know that there is no safe, healthy amount of alcohol use. The alcohol industry is still allowed to keep people in the dark by sowing doubt about scientific evidence. That's why we welcome the framework's ambition, its focus on alcohol policy best buys, and its evidence-based languages. We call on member states and WHO Europe to adequately resource full implementation of the framework, including at community level, facilitate regular review of progress, and ensure effective mainstreaming of alcohol policy considerations in all relevant policy areas in health and beyond. Alcohol policy is a catalyst for sustainable development, universal health coverage, and economic productivity. Movendi International is ready to support efforts to use the vast potential of alcohol policy to save lives, prevent harm, and promote of human potential. Thank you.
Thank you very much, Laura. And now I would like to pass the floor to Elizabeth Weiderpass, Director of the International Agency for Research on Cancer, to join us on the podium and tell us more about the consolidated evidence that lies at the heart of the framework in relation to the cancer.
That's fine. Excellencies, honorable ministers, distinguished delegates, colleagues from WHO for Europe, dear participants. First of all, ethanol, the main component of alcoholic beverages, is a group 1 carcinogenic to humans. It's closely linked to 7 types of cancer, including esophagus, liver, colorectal, and breast cancer. Last year, the International Agency for Research on Cancer published the global, regional, national estimates for alcohol-attributable cancer burden to inform alcohol policies and cancer control across different settings. This information is available on our website for your country, for your region. Globally, there are more than 740,000 new cancer cases per year directly attributed to alcohol. Globally, this is 4% of all cancers. In the WHO European region alone, 92,000 new cancer deaths every year occur. Every 24 hours, every day, 250 new cancer deaths occur directly related to alcohol. Esophageal, colorectal, breast, and liver cancers contribute to most cases, but this varies in different countries of the region. For example, in high-income countries, breast cancer is the most important alcohol-related cancer of all. Notable sex differences exist in different countries, and men are heavily affected in many countries in Europe. There is no safe amount of alcohol consumption for cancer risk. Each drop of alcohol increases cancer risk. Alcohol consumers should be objectively informed about the risks of alcohol consumption that exist at all levels of consumption, including but not limited to cancer. An IARC study showed that increasing taxation can effectively reduce the burden of alcohol-related cancers. About 11,000 new cancer cases and nearly 5,000 alcohol-related cancer deaths could be avoided annually in the WHO European region by doubling current excise duties on alcohol beverages. This would represent 6% of new alcohol-attributable cancer cases and 6% of cancer deaths attributable to alcohol consumption in the European region. This data will support the European Framework for Action on Alcohol 22 to 25. I thank you for your attention.
Thank you. Thank you so much, Elizabeth. Thank you, all panelists. We know what works. We have the solutions. We have the evidence. We have the science. It's now time to implement the regional framework for action. We count on your support. Thank you.
Merci beaucoup à tous. Je ouvre maintenant le débat et donne en premier lieu la parole à la Fédération de Russie.
Спасибо, госпожа председатель. Благодарим секретариат за представленные документы. С озабоченностью отмечаем, что употребление
and related illnesses are one of the most major medical and social problems in the region, and they are a reason for 1 in 3 deaths in the region, 1 in 10 deaths in the region. We are concerned by the fact that despite the evidence that we have about the WHO's instruments, they are not being fully used. I would also like to turn your attention to the problem which, in our view, is not being paid due attention. We think it is important to conduct work on prevention of alcohol consumption for pregnant women in order to prevent any alcohol poisoning for the fetus. In this regard, we deem it important to develop recommendations and guidance of WHO for prevention and diagnosis. The Russian Federation over the last 10 years has been calling to step up the fight against NCDs, and reducing the problem of alcohol consumption in our country is one of the primary goals of public health in our country. The WHO has come up with recommendations on a scientific basis, such as minimum pricing for alcohol, limiting alcohol consumption, alcohol sale times, etc. A ban on selling alcohol at night time has also been very successful indeed in the fight against alcohol consumption, and this has yielded positive results in our country. We would like to thank the WHO for the support that we have received when it comes to the framework framework policy that has been put together, which saw the involvement of the Russian Federation's experts. We are ready to take part in the consultations on fine-tuning the document. We note with regret that the proposal of the EU in the text of the resolution seeks to undermine the efforts of member states and the Secretariat and the WHO European region. However, we note the significance of ongoing work on this important matter, and we express our readiness to adopt the resolution on a consensus basis. Thank you very much, Madam President.
Merci, la Fédération de Russie. Je passe à présent la parole à la Slovénie, qui sera suivie.
Who will be followed by Belgium and by Greece. Slovenia, please go ahead.
Thank you, Chair. Dear Regional Director, Excellencies, Slovenia welcomes the new European Framework for Action on Alcohol, which is a product of extensive consultations with member states and other relevant stakeholders. We especially appreciate the much-needed step forward in the narrative of alcohol-related harm that this document brings, that we must drive down alcohol consumption as there is no safe limit to drinking. This development shows the commitment to an evidence-based approach, and we hope it'll bring a paradigm shift in how we think of alcohol and related harm. We were clearly reminded by the distinguished panel that alcohol is responsible for 1 million deaths per year in our region alone, and that we are speaking of preventable cause of death. We absolutely must do better to prioritize the health of our populations over other interests and follow the guidance that the WHO has prepared for us. The well-structured document puts forward many useful actions that will curb alcohol-related harms and assures commitment from the regional office to support member states in doing so. Slovenia remains committed to strengthening regional and global governance on alcohol policy. We believe that a legally binding instrument on alcohol remains an option to explore, as called for several times, for example, at the side event of the UN high-level meeting on NCDs in 2018, or at the side event of the last World Health Assembly hosted by Slovenia, Estonia, and Movendi International. We also believe that we must strengthen the SAFER initiative and that it will be helpful to bring back the global and regional focal point networks and to organize a ministerial conference on alcohol policy to raise the political profile of this public health challenge. I thank you for your attention.
Merci.
Thank you to Slovenia. I now give the floor to Belgium, followed by Greece and then Estonia. Belgium, you have the floor. Interpretation without text.
Madam Mr. Regional Director, dear colleagues, Belgium welcomes the European Framework for Action on Alcohol, which is presented to the Regional Committee for adoption. Alcohol drinking is one of the major risk factors for the development of non-communicable disease, including cancer, but also injuries and other social and health harms. This issue is particularly silent at the regional level, with the European region still displaying the highest level of alcohol consumption per capita in the world. Therefore, we thank the WHO Euro for the inspiring leadership in guiding member states on how to tackle alcohol-related harms. We welcome the policy options which are proposed in the framework with the aim of reducing alcohol consumption. We call on the WHO to continue to support member states with science-based guidelines based on clear public health goals and on the best available evidence. These guidelines are essential for member states in order to develop evidence-based public health policies free from undue influence. In order to prevent conflict of interest, we would like to reiterate our call to the WHO to work on specific guidelines dedicated to member states if they engage with the alcohol industry when developing public health policies. Thank you.
Merci.
Thank you very much to Belgium for your statement, and I give the floor to Greece, followed by Estonia, and then the United Kingdom. Greece, please.
Honourable Chair and colleagues, Greece aligns itself with the statement made by Czechia on behalf of the European Union and thanks WHO Regional Office for Europe and its highly esteemed Dr. Hans Kluge for putting high in the agenda the fight against alcohol in our region. The harms associated with alcohol consumption are a significant public health problem, contributing considerably to injuries, diseases, and death. The European region and the United States are the two regions with the highest alcohol consumption levels per capita and the highest contribution alcohol to all-cause mortality. Alcohol consumption is one of the leading factors for premature mortality and contributes to 3 million deaths each year worldwide. Various studies indicate that alcohol use disorders substantially lower the life expectancy in countries of the WHO European region. The need to reduce alcohol-related morbidity and mortality is of paramount importance for the quality of the life worldwide. The coronavirus pandemic became an additional factor affecting alcohol consumption. Data from the early stages of the pandemic suggested that anxiety and depression symptoms were more prevalent. Reported heavy episodic drinking before the pandemic tended to increase during the period. Greece participates in the regional consultation of the member states on the draft framework to strengthen implementation of the WHO European Action Plan to reduce the harmful use of alcohol 2022-2025. Up to now, a lot of important issues have been raised, among which are issues regarding effective alcohol policies, addressing the overall population alcoholic consumption. One of these strategies is the SAFER, a WHO-led initiative and technical package of 5 high-impact alcohol policy interventions that can help government prevent and reduce alcohol harm and related health, social, and economical consequences. Enacting and enforcing restrictions on commercial or public availability of alcohol through laws, policies, and programs are important ways to reduce harmful use of alcohol. Among its key principles, the SAFER initiative indicates the need to monitor and evaluate the impact of these interventions, as well as to protect public health from the alcohol industry's conflict of interest and interference in policy making. The Ministries of Health of the state members have an important role in helping to reduce or stop their drinking, to reduce health risks, and make health services to provide effective interventions for those in need and their families. As Deputy Minister of Health responsible for mental health and addictions, I share the vision that all vulnerable groups must have equal access to high-quality, people-centered mental health services based in the community in order to leave no one behind. Thank you for your attention.
Thank you very much to Greece. I now give the floor to Estonia, followed by the UK, and then Kazakhstan. Estonia, you have the floor. Please go ahead.
Thank you, Madam Chair. Honorable Regional Director, Excellencies. Estonia fully supports the adoption of the European Framework for Action on Alcohol 2022-2025. We highly value the leadership of the WHO Regional Office on this important public health priority. Europe has for a long time been leading as the region with the highest level of alcohol consumption globally. The European framework is thus a good basis to intensify our collective efforts to reduce alcohol-related harms. Evidence-based guidance and support to countries is essential to develop and implement effective alcohol control policies, while taking into account the specific needs and adapting the policy measures to the national context. Estonia has been committed to reducing alcohol-related harms by implementing a comprehensive alcohol policy in line with WHO global strategy and the best buys. We have achieved good progress. The per capita consumption of pure alcohol dropped by 1/3 from 14.8 liters in 2007 to 10.5 liters in 2020. Still, every year we are losing too many lives to alcohol consumption. In the recent years, we have experienced setbacks in the alcohol taxation policy due to the cross-border trade implications. This clearly highlights the importance of cross-border collaboration and the need to align public health policies. The Global Action Plan, adopted in May this year at the World Health Assembly, clearly states that there is mounting evidence that any level of alcohol consumption is associated with health risks. We are therefore convinced that, in line with the scientific evidence, moving away from the concept of harmful alcohol consumption underpins the public health policies aiming to reduce alcohol-related harms. Finally, we encourage the regional office to initiate regular discussions with the member states on alcohol control policies, to provide a forum for sharing the best practices and for monitoring progress. For instance, a high-level conference at the regional or global level could strengthen political leadership and be leveraged to promote cross-sectorial collaboration and to increase awareness on effective evidence-based policy measures. Thank you.
Merci, l'Estonie.
Thank you, Estonia. I now give the floor to the United Kingdom, to be followed by Kazakhstan, then Israel. The United Kingdom, you have the floor. Please go ahead.
I support the many points already made on the risks around alcohol use and the harmful impacts, and I won't repeat them, but I think the reasons for action in the region are very clear and set out by others. We strongly support adoption of the European framework. We really welcome the package of actions and the menu of evidence-based policies, so thank you for that. In the UK, we've taken a multifaceted approach to tackling alcohol-related harms. That includes licensing regimes, drink driving laws, public education, investment in treatment and in the wider health system, and regulatory frameworks. We've announced a comprehensive set of reforms to alcohol duty, which will, for the first time, ensure all products are taxed directly in proportion to their alcohol content. We're also reviewing how online advertising is regulated, including legal but harmful content such as alcohol advertising. And finally, just to say, our National Health Service is providing funding to support acute hospitals to provide specialist alcohol care teams in areas with the highest rates of alcohol dependence-related harm and deprivation. We'd be happy to share learning with member states and keen to learn from others in return. Thank you.
Thank you, the UK. I now give the floor to Kazakhstan, to be followed by Israel, and then Slovakia. Kazakhstan, you have the floor.
Уважаемые участники встречи, все мы знаем, что потребление алкоголя является причиной значительных
economic, social, and demographic harm. The consumption of high alcohol has a negative impact on life expectancy, and alcohol consumption in society leads to many deaths of our citizens. Alcohol consumption has a negative impact on the ability of individuals to work and has a negative impact on the labour market. Kazakhstan supports the implementation of the European framework for action to reduce alcohol consumption in the region. At this time, our country is pursuing a national policy to tackle alcohol consumption and alcoholism generally. To reduce the consumption of alcohol in the country, we have banned alcohol adverts, we have a minimum aging for alcohol, it's 21 years. There are high punishments and fines for any abuse of those laws. Today, in terms of public health, we need to teach young people about the harms of alcohol consumption. To this end, the Ministry of Health last year adopted a national project which seeks to carry out awareness-raising activities amongst the population about how to lead a healthy lifestyle. We are also conducting awareness-raising activities about NCDs. In the world, alcohol consumption is going down. Ladies and gentlemen, only through joint efforts can we tackle the scourge of alcoholism, and only this way can we get people to give up alcohol. Kazakhstan is committed to the implementation implementation of the WHO recommendations to reduce alcohol consumption. Thank you very much.
Merci.
Thank you, Kazakhstan. I now give the floor to Israel, to be followed by Slovakia and then Austria. Israel, you have the floor, please.
Thank you. Israel embraces the European Framework for Action on Alcohol as an important stepping stone in the effort to reduce the burden of disease resulting from alcohol consumption. Israel has already integrated key priorities identified in the action plan into its strategies, having, for example, introduced compulsory labeling of nutritional content and ingredients on products. Israel has also restricted alcohol availability. Israel also shares the framework's priority for action, such as provision of pharmacological treatment. In 2022, nalmefene was included in Israel's basket of universal health care. In tandem to pharmacological treatment, Israel has expanded the medical treatment of alcohol use disorder by means of intervention centers, which provide psychosocial treatment. Israel is making progress in other areas, with plans to provide new health information concerning health risks, including those related to cancer and mental health, especially among young women. Israel also embraces gender-sensitive and culture-sensitive approaches. Next year, in 2023, Israel plans to put a special focus on prevention of liver disease while deploying gender-sensitive strategies focused on reducing health inequities. Every year, Israel organizes an annual conference on fetal alcohol spectrum disorder to update professionals and families on preventive interventions. WHO's support for implementing these priorities by devising strategies, establishing action-focused networks, and documenting best practices plays an important role in reducing alcohol attributable harm, and we look forward to working with other international partners on these matters. Thank you.
Thank you to Israel. I now give the floor to Slovakia, followed by Austria and then Montenegro. Slovakia, you have the floor.
Thank you, Madam President. Dear Regional Director, Excellencies and colleagues, Slovakia would like to thank the Secretariat for important strategic document, the European Framework for Action on Alcohol 2022 to 2025, whose adoption we fully support. And also we appreciate the resolution, and we would like to announce our interest to be included in the list of the co-sponsors. We would like to use not commonly used optic on the alcohol impact. The alcohol consumption represents one of the main risk factors for non-communicable diseases with a serious impact on public health, and as we know, the research has proved that the codependent members of the affected families are the most exposed to secondary harms of alcohol use, which is mainly weaken their mental health. The research confirmed as well that the consequences of domestic violence, vulnerability, and linkage to the increased health risk related to diverse social determinants of health, but also negative behavior impact are drivers for alcohol consumption among youth, and recently also among populations experiencing war-related humanitarian crises facing serious psychosocial trauma. The lack of successful implementation of the evidence-based interventions and protective networks among those affected groups are also in general populations living with pre-existing risk factors, personal or environmental, crucial in driving the negative impact on NCDs in the region. Therefore, we need to adopt on the national and regional level such legislative acts and action plans which will help to protect vulnerable individuals in any traumatic incident affecting well-being of users of the alcohol, members of affected families, or communities for worsening their health in short or long term. We have to keep in mind that prolongation or complex traumatic incidents related to violence, abuse, weakened mental health, nutrition, low patient safety, self-esteem, and dignity of affected persons are factors having the ability to initiate process of pathways for any NCDs, acceleration, psychosomatic conditions, and social isolation on individual level affecting whole society. Based on the global strategy, Slovakia has adopted a national action plan for alcohol until 2030, which mainly aims at increasing health awareness, health literacy, and emphasizes the multisectoral character of alcohol policies. For positive adoption in the region, we recognize the need to establish stronger and vital consortium and focal point networks with actions taken based on the research, behavior, and impact measures at all levels and prevent neglecting the harms and vulnerability caused by this complex issue. Thank you.
Thank you. I will now give the floor to Austria, followed by Montenegro. Austria, you have the floor.
Vielen Dank, Frau
Thank you very
Vorsitzende.
much, President.
Österreich dankt für die
Austria
Erstellung des
thanks the
vorliegenden
WHO for developing the framework for action. Alcohol is one of the most important health policy topics at a global level. Indeed, only half of the global population consumes alcohol. However, this consumption is the third most common cause globally for disease and premature deaths after a low birth rate and unsafe sexual practices. Alcohol has an impact on NCDs and also communicable diseases. The European region is the WHO region with the highest consumption rate globally and the most alcohol-related harm. In the region, 40% of all diseases and premature deaths can be traced back to just 3 avoidable risk factors, namely smoking, alcohol abuse, and road traffic accidents. Austria supports the core ideas of the European Framework for Action to create a European region with improved health and social results. By the same token, we welcome the establishment of a safer European region free from alcohol-related harm as a long-term goal of the region. Alcohol, however, in Austria and indeed in other European countries is something that is socially acceptable and it is a core part of social life. For people who wish to consume alcohol, it is therefore important that they develop a measured and controlled approach to alcohol, and they must be aware of the risks stemming from excessive alcohol consumption. Austria, therefore, is not against alcohol consumption outright, but rather we are against harmful alcohol consumption. In the light of the common goal of reducing high alcohol consumption, we agree with the adoption of the framework for action. Thank you. Thank you, Austria. I now give the floor to Montenegro.
Thank you. And let me thank WHO for a great commitment since 2019 to steering inclusive and comprehensive consultations on the action-oriented and evidence-based alcohol framework. We particularly appreciate that the framework is aligned with the Global Action Plan and vision enshrined the European Programme of Work to considerably reduce morbidity and mortality from alcohol consumption. Recognizing context, specificities, and diversity, it is equally invaluable that the respective framework recognize additional measures to those outlined to be considered by member states in addressing alcohol consumption and related harms. Dear colleagues, evidence on alcohol consumption is strong, clear, and alarming. Alcohol kills. There is no safe level of alcohol consumptions. This evidence and alarming statistics is obliging as to take urgently coordinated action on alcohol consumption. We cannot afford any delay. The price we pay is far too high. Alcohol consumption is a colossal global health, but also social and economic development challenge, particularly in low and middle income countries. Rising healthcare costs, loss of productivity and life quality are the price we pay to alcohol consumption. We are witnessing detrimental and far-reaching implications of alcohol consumption affect not only the drinker, but also the family, the community, and the country as a whole. For us in Montenegro, it is particularly alarming and trend of growing alcohol consumption among adolescents, youth, and females. We are witnessing high prevalence of heavy episodic drinking or binge drinking We must not forget the situation of unrecorded alcohol is a huge challenge in Montenegro as elsewhere in the region. If we want to address alcohol consumption facilities by unhealthy environment and fueled big commercial interests, putting shareholder value ahead of the tragic human consequences, we need comprehensive solutions. Hence, Montenegro is strongly supportive of the WHO framework on alcohol consumption. Better health and safer future requires strong political commitments, coordinated multi-sectoral approach, and whole of society engagement. Thank you.
Merci.
Thank you, Montenegro. I have no further member states who wish to speak. Is that the case? Very well, thank you. No international partners who wish to speak. And on non-state actors, given that we had a panel with a number of non-state actors, I will close the discussion here. I will mention, however, the joint declaration of 16 non-state actors by Milka Sekulovic from the European Public Health Agency. You can look it up online. I now turn to the Secretariat, to our Regional Director, for any reactions he may have to this.
Thank you very much, Executive President. I would like to express my very sincere appreciation to our wonderful panel, and then to reassure that we heard the calls from the Member States for technical support, particularly from Belgium, the guidelines to support public health stakeholders from influence from the industry, and the Russian Federation, that I'd like to assure that I have heard the call to WHO Regional Office for Europe to pay more attention to alcohol harm reduction, and I remain very committed. Thank you.
Merci, Hans.
Thank you, Hans. We can now move to the resolution that has been proposed. The reference number will be put up on screen. Can the regional committee adopt this resolution? Are there any objections?
Je n'en vois aucune.
I see none. I therefore declare the resolution adopted.